and I'd trip and fall down because my legs just didn't work right. And so that's when I decided I needed back surgery. And in 2010, I went for back surgery with a local surgeon, and he fixed the stenosis, but he really didn't fix the nerve problem affecting my legs and my feet. You know, I waited a year and a half after that surgery for things to get better, and they only got worse. So I went back to physical therapy. That really didn't do anything. I decided to get surgery, and I decided Dr. Arginteanu was the guy to do the surgery.
Hello, I'm Marc Arginteanu. I am a neurosurgeon. I am part of Metropolitan Neurosurgery Associates. I've been in practice since the late 90s. I did the neurosurgical residency, followed by an orthopedic spinal surgery fellowship. So when I first met Gene, he was having a lot of trouble with the lower back. Initially, he had gone to see another surgeon, and that surgeon had told him that with just a minimally invasive decompressive surgery, he had a high chance of making Gene all better. Unfortunately, the type of problem Gene had really wasn't amenable to that type of surgery. So he went through that procedure with the other doctor. He got a little bit better for a short time, but very soon his pain came back and it was worse than ever. The reason why that decompression didn't work is in Gene's particular case, he not only had pinching around the nerves, but he had slippage of the bones. The doctor's word for that is a spondylolisthesis. So in the setting of a spondylolisthesis, if you just do a decompression, sometimes the underlying condition can get worse, and that is indeed what happened with this patient. In addition to the pain he was having weakness of his feet and a progressive paralysis of the muscles of his feet. Based on all of that examination and history, as well as review of the imaging studies that were available, including MRIs and X-rays where we had him moving in flexion and extension, I had recommended a more definitive procedure than just a decompression. Additionally, we were going to take out the discs and replace those discs with prosthesis that would hold the space open and restore his anatomy to as close to normal as possible. And we believe that if we did that type of surgery, it would give him his best chance of regaining some of the strength in his feet and also having the ability to enjoy a good quality of life and pursue his activities of daily living.
Anybody I know that has back problems, he's the guy, anybody in my family, I would drive him up there to see Dr. Arginteanu.
So it has to be the right procedure for the right patient at the right time in their particular life. And you have to evaluate each person as an individual with their individual circumstances. There is no one-size-fits-all ability to say this is what you're going to need, regardless of what the MRI looks like or what other doctors have told them. We take a fresh look at people before making any recommendations, either surgical or otherwise.